Buoy Health Insights, Stomach Cramps. Hello, and welcome to another episode of Buoy Health Insights. Today, we're exploring a common issue that many of you might have experienced: stomach cramps. Stomach cramps, also known as abdominal cramps, can feel different for everyone. Some might feel a dull achiness, while others might experience sharp, stabbing pain. These pains can be due to a variety of causes, such as eating foods that irritate the stomach, constipation, food poisoning, infection, or even stress and anxiety. One of the potential causes of stomach cramps is a viral or bacterial infection, commonly associated with stomach flu. This means an infection caused by viruses like norovirus or bacteria that spreads either person to person or through contaminated food and water. Symptoms can include a stomach ache, nausea, vomiting, diarrhea, exhaustion, and fever. If you have these symptoms, especially if you have a fever beyond 100.4 giraffe or can't keep down any food or drinks, you should seek medical care, as you might be dehydrated and require treatment at a hospital. Another common cause is food poisoning. Eating contaminated food can introduce germs like bacteria, viruses, and parasites, or toxins produced by these germs into your system. The symptoms appear several hours or days after eating the contaminated food and usually involve stomach pain, nausea, vomiting, diarrhea, and exhaustion. Again, if these symptoms become severe, it's time to see a doctor. Moving on to food sensitivity. This can also trigger stomach cramps. Sensitivities are most often related to eating greasy, sugary foods or consuming carbonated and caffeinated drinks or alcohol. For example, lactose intolerance, a common food sensitivity, occurs when people can't digest lactose, a sugar found in dairy products. Symptoms of food sensitivity typically go away on their own or can be managed with over-the-counter medication. However, to better understand which foods might be troubling you, keeping a food diary can prove helpful. Irritable bowel syndrome, or IBS, is another condition worth mentioning. It's a chronic disorder of the gut that causes abdominal pain and changes in bowel movements, such as diarrhea or constipation that can be unpredictable. It's important to discuss your diet with your doctor, as certain foods or drinks can trigger symptoms. Fiber supplements, exercise, stress management, and sufficient sleep can all help manage the symptoms of IBS. For menstruating individuals, menstrual cramps can cause discomfort in the lower abdomen, as well as nausea, diarrhea, bloating, fatigue, and headaches. These cramps occur as the uterus contracts to shed its lining. Over-the-counter medications like NSAIDs, exercise, and heating pads can help ease symptoms. However, severe cramps that interrupt daily activities should be evaluated by a doctor, as they could signify a more serious condition. If you're someone who has periods of constipation, when it's tough to pass stool, it's likely been accompanied by stomach cramps. Constipation may arise from not consuming enough fiber, water, or lack of exercise. Relieving constipation typically involves dietary changes, hydration, regular exercise, and over-the-counter medications, and it's crucial to see a doctor if it persists, as it can sometimes be a sign of more serious health issues. When should you raise the alarm? You should be very concerned if your stomach cramps are persistent over a week, are extremely severe, or accompanied by symptoms like a fever or blood in your vomit or stool. Remember, this video is for informational purposes only. Always consult a healthcare professional for medical advice specific to your situation. If you found this information helpful, make sure to like this video, subscribe to our channel for more health insights, and share with those who could benefit from our discussions. Stay healthy!